When people have low back pain, they oftentimes are told or given the impression that they need to strengthen their core. And while this can be part of the solution, I often find they don't pick the most effective exercises. I commonly see that people overly fixate on exercises like crunching or core stability exercises, which primarily train the rectus abdominis or the six-pack abs muscles. Many times within a low back rehab program, the initial goal of mine is to teach the individual how to better achieve and maintain a good stack of their head over their rib cage, over their pelvis, over their foot. If you're better stacked, you have the ability to better move into extension or flexion or rotation because you're moving from a better starting point. Now, the problem with overly fixating on exercises that train the six-pack abs, because they attach here and down here at the lowest part of the pelvis, when those two attachment sites come closer together, it does this, which compromises the position of the stack. However, if we consider our deeper ab muscles, like our internal obliques, those run from the ridge of our pelvis to our lower rib cage. So they have the ability to, for example, bring the rib cage down and rotate the pelvis back into a position that is more stacked without bringing the entire rib cage down with it. So many times a goal of mine is to get that stack through the internal obliques and the transverse abs without much engagement or contribution from the six-pack abs. Here are 2 easy exercises you can do to help get more contribution from the side abs to create that stack rather than relying on your six-pack. This first one is a side plank, but done a little bit differently. So get this leg straight out from your side, this leg bent around 90 degrees. We have a towel roll underneath our first 2 fingers in the inside portion of our forearm because this is going to allow us to better push through the ground. Most people can't do that effectively, and when they end up trying to get their hand flat, they end up rolling their shoulder forward to do that. Now, evenly press through this forearm and hand into that towel and through the floor to get yourself elevated. Keep your sternum up, rib cage down, looking straight ahead. You're going to feel your abs working a lot here. Breathe in through your nose, out through your mouth for about 10 slow breaths. Get 1 foot length away from the wall with a foam roller in between your thighs so your knees stay in line with your feet and your hips. You should have your weight evenly spread between both feet, feeling knees contacts. Keep a chair close to you because we're going to need it in a second. But first, bend your knees, maintaining those foot contacts, and then stop at the point where you start to feel these PSIS contacts on the backside of your upper pelvis. Now, keep your eyes perfectly straight ahead and reach that chair very slightly away from you, not depressing your sternum as you do it. Now, maintain those foot contacts, the PSIS contacts, and just exhale through your mouth fully, like you're trying to fog a mirror. At the end of that exhale, you're going to feel your side abs, not your six-pack, but your side abs engage. Pause, close your mouth, silently inhale through your nose, maintaining that side ab tension.